أولا الشكر لله سبحانه وتعالى على هالنعم، وهذه نعمة من رب العالمين.
I wanted to first thank God on the name of God Almighty.
ثانيا الشكر لحكومة قطر، هي اللي كان الدعم الكبير منها، سمو الأمير الشيخ حمد بن خليفة الثاني حفظه الله، وسمو الشيخ تميم بن حمد الثاني ولي العهد الأمين حفظهم الله ورعاهم.
I wanted to thank our government of Qatar and especially His Excellency the Prince Al-Sheikh Hamad bin Khalifa Al-Thani and Al-Sheikh Tamim ibn Hamad Al-Thani, the Crown Prince, for his giving gift to be here.
والشكر الجزيل للدكتور أندريا تزاكس، هو اللي سوى عملية الزراعة في 2007.
I wanted to thank also Dr. Andrea Tsakis, who performed her transplant in 2007.
وفريق الزراعة دكتور تيكن ودكتور فان.
And the team of the transplant, Dr. Taken and Dr. Fan.
ودكتور صالح ياسين، هو جزء كبير من النجاح الكبير.
And he wants to thank also Dr. Salah Yassin. He's the big part of the following up her all the 9 months.
يعني هذا إنجاز الواحد يتكلم فيه للناس اللي بيكونون بعدنا، فإحنا لما جينا على هالخطوة كان شيء صعب إن إحنا نختاره، وإن شاء الله إنه بيكون شيء خير وجواب حق الناس اللي ما عندهم أجوبة على أسئلتهم في هالحال.
And he wants to thank God and wanted to say that they came here. It was hard in the beginning and a hard decision, and he wanted to be like to give hope to the other people that they had transplant and to give them a chance to be.
وشكر على مستشفى جاكسون على هذا الشيء اللي سووه، ويكون خبر حق الكل وشكر.
And they want to thank especially the Jackson Memorial Hospital, and it will be a good news to everyone.
That's it. Thank you.
Thank you.
Fatema.
How did they end up here, all the way from Qatar?
بيقول لك ازاي جيتوا هنا وصلتوا لغايه هنا من قطر الاول؟
دكتور أندريا تزاكس هو كان صديق له دكتور بكر نور، هو دكتور بعد multivisceral transplant. هو اللي دلالنا، يعني ما كان عندنا حل.
He is
هو اللي دلالنا على، قال لنا لما شاف الحالة هو قال حلها الزراعة.
Yeah, he is
هو اللي بعثنا حق دكتور أندريا تزاكس.
He is Dr. Bakr, what's his name?
Noor.
Dr. Noor from Qatar. He is a friend with Dr. Zakis here, and he advised them and guide them to come to here, and the only solution for her was the transplant.
How are her mother and daughter feeling?
بتقول لك انت ايه احساسك انت وبنوتك؟
الحمد لله رب العالمين.
Thanks God.
يعني إحساس ما أعرف أوصفه.
It's a hard feeling to express.
أحلى إحساس بالدنيا.
It's the best feeling in the world.
Back in 2007, did you ever think you would have the chance to be able to carry a child?
بتقول لك لو في 2007 كان عندك امل، كنت تفكري انك ممكن هيجي يوم وهيبقى عندك طفله؟
الصراحة يعني ما كنت أفكر لأن صحتي كانت وايد تعبانة.
She couldn't think on this on 2007 because her health was bad and she was only thinking to be healthy and to recover from her transplant.
And so how does it feel now that your health is recuperated and you had all the transplants but you were still able to have a miracle baby?
بيقول لك ايه احساسك انك انت بعد ما عملتي الزراعه وصحتك احسن وصلتي معجزه انك جت ميراكل بيبي؟
الحمد لله رب العالمين، هاي بفضل الله سبحانه أول شيء.
And thanks God, this is great for gift from God.
و يعني فضل زوجي ما قصر معي، وقف معي في كل من أول يوم الزراعة لين حملت لين ولدت، طول هالسنين 6 سنوات الحين. الحمد لله رب العالمين.
And she thanks God again, and she thanks her husband, especially her husband, Mr. Al Hayal, because he stand by her all this year from the day when she was sick on 2007 through the transplant to until now.
And you had tried several times to get pregnant once you recovered. What was the feeling when you finally heard that it took and you were pregnant?
بتقول لك ايه احساسك لما سمعتي الخبر انك حامل بعد محاولات كذا مره للحمل؟
يعني احساس شعور وايد حلو ما اعرف اعبره. يعني كنت انتظره من 6 سنوات. حاولت انا مرتين من قبل اني احمل في الاي في اف وما صار، ما الله كتب. بس الحمد لله رب العالمين المره الثالثه صار. فيعني ما اعرف اوصفه.
She has a hard time to express her feeling. It's a great feeling. She waited for it for 6 years. She tried twice before the IVF and wasn't successful. And she's very happy, and it's hard to express my feeling.
What's it like for her being the first in the world to have a baby with multiple organ transplant?
بقول لك انت ايه احساسك انك انت اول واحده في العالم انك تنجبي وتجيبي طفل بعد زراعه؟
ما اعرف نفس الكلام، ما اعرف اعبر عن الاحساس. يعني الحمد
It's
لله
hard to
والشكر.
express. Thanks God, Almighty God, for His blessing.
هاي هدية من رب العالمين.
She's
الحمد
a gift.
لله رب العالمين.
She's a gift from God and a miracle.
And the baby seems to be very well tempered and quiet. Is she always like that?
بتقول لك ان هي شايفاها انها هاديه
الحمد
she's
لله.
always كده، انها على طول كده.
الحمد لله. إيه.
Thanks God, yeah, she is.
What are their plans now? What special precautions do they need to take, if anything? What are, from now, what happens?
بتقول لك انت من دلوقتي وبعدين هتعملي ايه؟ I think the doctor has to answer this question. That how her
Well, I'll give first word to Dr. Yasin because he's been following them for almost a year for the pregnancy. I want him to speak up and we will answer the questions separately, I guess, in terms of transplantation and pregnancy.
Well, first of all, Doctor, we'd like to hear from you as to how astounding this birth is, and also what is next for this family.
First, I appreciate your presence, and especially here in Jackson. And I really want to stress the importance that it is not just simply having a baby here. This is a first time ever in the world, and we have searched all medical literature, all registries in the whole world, including Europe and the States, for any pregnancy that had 5 multivisceral transplant, and this is the first case to our knowledge. We are not aware of any. There are 1 or 2 cases in Europe that had 2 organs, but not 5. So this is number 1. Number 2, the issue of transplant, the details regarding transplant, although we have taken care of multiple or many ladies with transplant in the past, kidneys, liver, heart. Generally speaking, it is one major issue that we had to deal with, although there are many other complexities. But we have to be honest. This is the first. We don't claim that we have experience in multivisceral transplant. Nobody did. It has taken the team of Jackson Transplant and University Transplant Institute who started this whole process. To have an adult going through multivisceral transplant and make it to the degree that she is healthy enough to consider having babies is a miracle by itself. Number 2 is once she got pregnant, that was the other challenge. We did not have such an experience in pregnancy with this kind of situation. So we have to take the most cautious approach towards following the pregnancy, making sure that the mother is doing okay, making sure that the baby is doing okay inside, with medications on board, paying very close attention to all possible complications that could happen, and subsequently they were the most compliant patients you can ever think of, would not miss an appointment, would not miss a test. And we had the support of the liver transplant service to assure that things are online. And we were blessed where we are now. The concern was throughout the whole system is how her body will be able to take care of the load of being pregnant and how her organs would react throughout the pregnancy and shortly thereafter. So far, things have been in the right direction. The liver transplant team has been following her very closely to make sure that her medications are on board and there is no medical events or complications. And definitely at this point, from the pregnancy point of view, she delivered. She is healthy, her baby is healthy, she is recovering, believe me, better than many women you know of. And the rest will go as to the usual care of her transplant by the transplant team, because there are still always things have to be monitored.
How risky was it for her to get pregnant?
This is the whole situation that there is no experience. We have experiences in the past with liver transplant, kidney transplant, pancreatic transplant. We have that experience and we know that information, that it is not an easy pregnancy to go through. One has to monitor medications, one has to make sure that the transplanted organ is not rejected, that the medications are safe as much as they can to the baby, and that the baby is growing well and the pregnancy is progressing normally. So all of those factors were in our heads throughout the whole thing. How is it safe? It wasn't, we did not have information about 5 organ transplant and pregnancy. So we took the worst case scenario, meaning you have to be as vigilant and as anybody can be, make sure that you monitor every little aspect of it, and deal accordingly. Now we can say it is good what we had, healthy mother and healthy baby. And the important, this issue for this pregnancy is multivisceral transplant is mostly a procedure that mostly is done mostly for children. At least nowadays the experience, and Dr. Tikan and Dr. Fa can dwell on that. But those kids, those young girls who are having transplant at now when they are 5 or 6 or 7, let them know there is hope. And it takes probably a village to get where we are, but it's a nice, pleasant feeling of having positive attitude toward things.
Do you think she'd be able to conceive again? Would that be possible after this?
Of what Dr. Tikan and I saw in her abdomen and pelvis, why not? With the same cautious approach, stressing this point, because again, we don't claim knowing what would happen in the future, but at least we would need to be as attentive to every little details.
Would mom want to?
In God's will.
Probably we'll see her again.
So was the pregnancy smooth, no complications?
There were a few events here and there, but nothing really to write home about. We got worried, for example, of major infections of patients with liver transplant. She did not have any. She had the flu, she had a little bit of bleeding here and there, and a lot of physical discomfort, because that was a major problem, because with this kind of transplant, the organs are not really exactly where they are. And so there was a lot of physical discomfort, but she sailed through very nicely.
Would you mind asking her if this is something that she would like to try again?
To be pregnant again? عايزة تفكري إنك تعملي
قبلها إن شاء الله بإذن الله إحنا في أيدي يمين.
Hopefully, and they are in a good hand here, and they hopefully
فريد الصراحة
to come back to
Do it again.
do it again.
From our part, at least now, Dr. Tiken and his team are monitoring her medications to make sure that all the anti-rejection medications she's on are nicely monitored, her organs are functioning well, and probably in the coming week or so.
Of course. I will probably repeat some of the things Dr. Yassin mentioned. Multi-organ transplantation is a rare transplantation. It's very, very complicated compared to other solid organ transplantation, but thankfully successfully being done in this institution. It was the first for us also, not only for the family and for the OB team. We were very nervous in many ways, but I'm very happy and thankful to everyone involved because everything went very smooth. The transplant team is not like one person, it's a significant amount of team members. Actually, some of them are not here, so I would like to emphasize Dr. Andreas Tazakis, Dr. Seigo Nishida, Dr. David Levi, Dr. Jifan, myself as a surgical team who were involved, but also a lot of coordinators, the other divisions who work with us, because to really keep a multivisceral transplant patient in good shape takes more than 100 people effort. On top of it, you have a pregnancy that you did not ever experience in this kind of situation. Of course, put everyone on a little bit on their toes, but the outcome was magnificent. I was privileged to be next to Dr. Yassin and happy to be there to see this miraculous event. And this gives, as Dr. Yassin said, hopes to the other people who had multi-organ transplant. Just as a comment, of course, pediatric population is a little bit more, but we have a lot of adult young females who had multi-organ transplant, and still some of them are on transplant list today. For them to see this is a significant event, I think.
And do you publish this in a journal or something?
That is natural. There are, as Dr. Yassin said, few isolated intestinal transplant cases who got pregnant, couple organs, but never a 5-organ transplant, had a successful pregnancy and delivery.
Do you know where this may be published?
Most likely will be published in the obstetrical literature, but its significance, it will be again another team effort so that we make sure that the information is as informative, as scientific, and as beneficial to the specialists here and abroad, so that that is really precious information, not only for us as a team feeling privileged to have the chance to take care of this family, for the institution to make sure that all the efforts did not go unnoted, and for many other people in which we need to keep in mind that miracles occur and there is always hope, and if people put their hands together in a very concerted manner, outcomes could be mostly improved.
It's one thing significant we need to mention. These kind of events cannot just happen in small or certain places. It should be a special institution. I think Miami Transplant Institute, with the combination of University of Miami and Jackson Memorial Hospital, really provided this environment to have this multidisciplinary approach in a very complicated patient to get successful outcome. If you don't have a support from your hospital, from your divisions, there is no way you can be successful. And that's the reason many people around the world come to these kind of centers. And we are also happy to be one of those centers.
El resultado es que ella tuvo varios trasplantes, fueron un total de 5, pues un día que la operaron, pero como siempre son tantos órganos que algunas veces tienen que requerir de nuevo de ir a la sala de operación. Tuvo un poco de otras intervenciones, pero solamente fue una cirugía grande que le trasplantaron los 5 órganos.
¿Ella necesita de algunos cuidados especiales en lo sucesivo por los 5 trasplantes que recibió, o tiene una vida normal como cualquier ser humano a partir de ahora?
Lo que pasa es, después de un trasplante tan grande, que fueron 5 órganos, el cuidado es muy especial. Para cualquier persona que requiere un trasplante, especialmente los primeros meses, es bien importante que hay un cuidado especial con los medicamentos. Primero el medicamento no todas las personas lo toleran, y al resultado de eso tenemos que estar vigilando a la persona. Y la otra preocupación al principio mucho es cómo van a aceptar esos órganos, si va a haber, los chances de rechazo son más grandes. Después de unos tiempos, el primer año es el más difícil, pero después del primer año los chances de vivir una vida normal es bastante grande. Pero siempre tiene que haber un cuidado que los pacientes tienen que recordarse de cuidarse, de ir al médico, contra las infecciones, porque ellos están más comprometidos a coger infecciones durante ese tiempo.
¿Cuánto tiempo pasó desde que tuvo los trasplantes a cuando quedó embarazada?
Ella tuvo el trasplante en 2007 y entonces quedó embarazada hace 9 meses.
O sea que ya pasó el primer año de vida.
Sí, correcto.
Ahora, con esos trasplantes que ha recibido, ya lo dijeron en inglés, pero de todas maneras para tener la declaración en español, ¿ella puede volver a quedar embarazada de una manera normal o tiene que ser bajo una vigilancia médica?
Básicamente ella puede quedar embarazada de nuevo, pero como siempre tienen que coger la misma precaución que tuvieron esta vez. No fue fácil ella salir embarazada, tuvo que recibir tratamiento especial, pero después de 2 veces que trataron, ella pudo salir embarazada de nuevo. Puede ser que va a requerir eso para ella salir embarazada de nuevo, pero con la vigilancia, si ella quiere de nuevo, del equipo especial que tenemos aquí en el Instituto de Miami, eso podía pasar de nuevo.
Es decir, inseminación artificial.
Correcto, hicieron inseminación artificial. Una decisión finalmente con el obstetra si se puede hacer o no.
De la misma forma, lo que están diciendo es de la misma forma que nosotros aconsejamos a los pacientes, que después de un trasplante siempre dar el pecho es un poquito riesgoso dependiendo de los medicamentos que está tomando. Eso es algo que ellos discuten con los médicos de trasplante, con nosotros, y típicamente no lo dejamos, pero...
¿Y el bebé nació con un peso normal dentro de la media, quizás de una gentilicia de su país o de cualquier bebé?
Completamente normal.
¿Y no necesita ningún cuidado especial el bebé tampoco?
El bebé, como cualquier bebé que nace en esta institución, pasó 2 días aquí, pero después de eso ningún cuidado especial por la mamá.
Ahora, en lo sucesivo, ¿ella tiene que volver a Jackson a seguir su tratamiento o su control, o lo va a hacer en Qatar?
Basado en el trasplante, ella puede regresar a su país a hacer sus tratamientos, pero siempre nosotros estamos vigilando. Algunas veces los laboratorios nosotros los recibimos, y básicamente un par de veces durante el año puede ser que ella tenga que regresar para verse con el cuidado del trasplante.
Ahora, ¿esto abre una esperanza para otros pacientes que tengan una situación similar o que quizás hayan recibido un trasplante y ni siquiera lo hayan intentado, lo hayan pensado por haber pasado por esa situación? ¿Se abre una esperanza para posibles mujeres en edad de poder concebir?
Exacto, lo que habían dicho es que por lo menos la mayoría de los pacientes que pasan por este mismo procedimiento son pacientes pediátricos. Esos son pacientes que tienen entre, vamos a decir, 7 y 10 años. Mientras que nosotros estamos avanzando, estos pacientes van a entrar en la edad reproductiva. Y hasta ahora este es el primer caso donde nosotros hemos visto que una paciente de esta forma ha quedado embarazada. Y le da mucha esperanza a esos pacientes que en esta etapa están entrando en la edad reproductiva de ellos.
Ella tiene 24 años ahora.